grant producer officer with us. Vince, do you want to go ahead and start, please?
Sure. Thanks, Matt and Stephanie. Well, good morning and good afternoon to everyone. I appreciate you all taking time out of your busy schedule to join us today on what we think is really a very important milestone within VA. As many of you know, nationally, around a year ago, the Comprehensive Federal Strategic Plan to Prevent and End Homelessness was announced, and it was clearly endorsed by all the major cabinets in the current administration, and clearly focused on ending homelessness among veterans. And in fact, in the plan, veterans are sort of featured as one of the 4 high priority goals, overarching activities of the Federal Strategic Plan. And that part of really being able to move forward with ending veterans' homelessness has to be linked to ensuring that we're all documenting and identifying homeless veterans in the same manner. For many years, VA and our partner HUD have kind of run parallel systems in how we identify, track, and count homeless veterans in our communities where the veterans are on the streets or in our transitional housing programs. And as part of the federal plan, there's been a commitment between the agencies to move forward with one sort of unified way of counting and monitoring progress as it relates to ending homelessness in the communities. And to that end, VA has been engaged with HUD and looking at ways in which VA will more actively participate with the continuums of care and in the HMIS system. And so today is one of the initial calls to dialogue with you about what's that going to look like, how is that going to take shape, what are going to be some of the first steps. You know, VA in this past PIT count was very active in participating in many of the communities. We hope to make sure during the next PIT count we're with all those communities. VA has sent out some clear messages to our community partners, particularly our contract housing providers and our grant and per diem providers, around what our expectations will be for them to participate in their local HMIS system. And that Roger Casey is going to talk a little bit more about that in a minute or two. But this is one of the first steps of many that VA will be taking with you to try to be more engaged in the homeless management information systems at a local level. We will have some struggles. There are some parallel systems that we need to keep working on before we can have full integration or you know, a stronger dialogue between our tracking systems and yours. But the commitment to having sort of a unified way of identifying the prevalence of homelessness among veterans at the local level and shared metrics is very much a priority for the VA, and that we see today as really one of the first steps in a direction where we will be more active and more engaged with you in identifying the needs of the homeless veterans through the homeless management information system. So we appreciate your patience in advance. This is relatively new to us. Many of you have been doing this for several years. We're going to be aggressively playing catch-up, learning from you, so we appreciate your patience. But we want to make sure that it's a dialogue and that we have our local medical centers and our community partners working closely with you in key programs. The first clearly will be our grant and per diem program, but this will shortly be followed by some of the prevention initiatives that we will be launching later this summer. And then in FY12 and 13, we'll be looking at ways in which our HUD-VASH program and other programs will be putting some information into the HMIS systems as we move forward. But today we want to kind of more exclusively talk about the first step, which is ways in which we can have our grant and per diem providers more actively engaged at the local level, entering information into the HMIS. So with that, let me turn it over to my colleague, Roger Casey, who's been running that program for a number of years, and we'll kind of talk about sort of some of the next steps and key strategies that will be important for us to work together on to help our partners successfully place information into that system so that we can best identify their needs at that local level. So Roger, let me pass this over to you.
Great, thanks, Vince. Can you hear me okay, Vince?
Yes.
Great. Hey, everybody, it's Roger Casey. I'm the Director of Grant Per Diem Program. I know many of you on the line, and those that I don't, I appreciate you dialing in. As Vince said, VA embarked on a very bold initiative during the last few years to end homelessness among veterans, and part of that is to really make sure that we have the best, most accurate, and timely data to ensure we're doing our job, and also to make sure that we identify gaps. And that's part of what Vince was saying, to make sure the data talks to each other and the numbers talk to each other. And as Vince said, VA has been running parallel to HUD over the years, and this really is a very bold and strong and ambitious effort for us to really make sure that actually it's a part of this effort to end homelessness among veterans, and I appreciate everybody dialing in. The Grant Per Diem program has been at least one of the cornerstones of VA's homeless programs, and one, I want to make sure that I thank all of you that are Grant Per Diem providers, or those folks that work with Grant Per Diem programs, for all the work you do. And also to let you know that for those Grant Per Diem programs that are already hooked up and running up and engaging in the HMIS effort, we really appreciate your efforts. It's actually going as good as we can expect, even better in some cases, and we know there's some bugs to work out in individual sites, but we really appreciate all the work you've done. So I guess the bottom line, and I'll keep this short, is one, I want to thank you for all your work, but two, to make sure that you know that it's important from our office, the Grant Per Diem office, to ensure that you guys have help that you need to start this effort or continue this effort, and that it's really important for us, and it's all part of a bigger mission. And the mission is not only to end homelessness among veterans, but it really is to make our programs better, more efficient, and to ensure that we're providing the care that we need to do, providing the care we need to provide. Want to make sure that I thank Apt and Associates for all the work that you guys have done. It's really been a tremendous effort, and all the work the National Center on Homelessness Among Veterans has done. This is a pretty cool thing. So thanks, Grant Per Diem folks, for dialing in, and you have our support, and I'll turn it over to Stephanie and Matt.
Wonderful. Thank you so much, Vince and Roger, for taking the time out to kind of get us started on today's webinar. I'd like to, again, reiterate and welcome each one of you for the webinar training on HMIS participation requirements for the Grant Per Diem program and other programs. My name is Stephanie Nagy from Apt and Associates, and today I'm joined by my colleague, Matt White. Apt and Associates has been engaged by the VA to assist the VA in their planning and development and implementation of the HMIS for VA-funded homeless programs. Matt and I will walk you through these slides and provide additional guidance and context regarding VA participation in HMIS. We understand that HMIS participation is new for many of you, and you may have questions about this new initiative, the impacts on your GPD program. We've established a dedicated email address to manage these questions related to the VA participation in HMIS. During the presentation and throughout the next few years, any questions related to HMIS participation requirements can be directed to VAHMIS@abtassoc.com. It's at the bottom of the slide that's on the screen, but again, it's VAHMIS@abtassoc.com. These slides that we're going over today will be posted on the VA website, as well as the HUD HRE website, which is hudhre.info. So with that, let's get started. The training objectives for today, we have 3 of them, and we hope that you'll understand at the conclusion of the training the core concepts of the HMIS system, which is the Homeless Management Information System, or HMIS, and how VA programs are expected to participate within it. Identify the intersections between HMIS and the work of the VA, including the VA's strategic plan to end homelessness among our veterans, as well as receive clear direction for the necessary next steps to get started, as well as resources available to assist you on the implementation of HMIS for your programs. Our training agenda includes the following: an overview of VA participation, the SSVF and HMIS, roles and responsibility, the VA long-term plans for data collection and management, as well as resources and upcoming trainings. Our call will last about 60 minutes. We won't be taking any live questions, but we encourage you to email any questions during the training as well as after the training to the email address vahmis@appasoc.com. As mentioned, the materials from today's training will also be posted on the VA website as well as the HUD HRE. Why is the VA programs expected to participate in HMIS? We understand that the VA-funded programs already provide client-level data to the VA on all of their participants within their VA programs. However, in order to have a comprehensive understanding of homelessness amongst veterans and the effectiveness of the VA-funded strategies to end homelessness, the VA is implementing a new approach to collect information electronically from the VA and community-based organizations about homeless veterans and the services veterans receive. The new data collection approach focuses on data from homeless programs funded by the VA, but will ultimately provide stronger data about even those homeless veterans who do not seek assistance from the VA or many of the VA-funded programs. Further, the VA strategy will improve information on VA homelessness at the community level, which is intended to facilitate closer coordination of VA-funded and non-VA-funded programs to improve community planning around veteran homelessness. In January of this year, the VA directed all GPD grantee providers to participate in the HMIS systems associated with their continuum of care where the GPD beds are located. The goal was to start the participation of all GPD beds by March of this year. We know that most GPD programs were successfully able to work with their local HMIS project staff to get their GPD program set up in HMIS, receive the necessary training and support for the GPD staff who were entering the data, and start participating in HMIS. Remember, project grantees of the Grant Per Diem program are responsible for ensuring complete and accurate entry of client-level data into the local designated HMIS system. VA staff are not responsible for entering the data into HMIS. If you are unable to successfully start HMIS participation, please email us at vahmis@appasoc.com, and we'll follow up with additional support and guidance. We want to make sure that GPD programs have the training and resources necessary to be successful with the HMIS participation. GPD beds should be listed on the EHIC or housing inventory count as transitional housing with the prefix GPD. GPD beds may already be accounted for in the HIC, sometimes as emergency or EF. If GPD beds are funding source is used to support existing programs listed on the HIC, COC should be careful not to double count GPD, and where GPD funded beds are currently listed as emergency, they should revise their HIC to show them as transitional housing with the prefix GPD. GPD grantees are directed to collect universal data elements at a minimum. GPD grantees are welcome to enter additional data beyond the baseline requirement of universal data elements, but any additional data collection is a local decision. GPD programs do not have additional resources beyond the per diem allotment to underwrite the potential cost of HMIS participation. Not all HMIS implementation imposes a participation fee, but some do. Any licensing and other costs associated with HMIS participation will need to be covered within each GPD grantee rate if the per diem rate has not reached the maximum allowable under the grant. The VA is investigating alternative funding opportunities for those GPD grantees already at the maximum per diem rate. The VA understands that paying for participation fees may be a barrier for participating for some GPD programs in particular. The VA is exploring options for support and resources to offset the cost of grantee participation in the future. Many VAs fund community contract beds, which function as emergency shelter beds. In order to build a complete picture of the total resources and inventory available to any persons experiencing housing crisis, HUD and VA have agreed that VA community contract beds should also be participating in HMIS as soon as possible. Community contract beds should be listed as emergency shelter within the COC's HIC. Community contract providers should collect universal data elements for the program participants and enter those into the HMIS system. The VA Medical Center services, coupled with the HUD's Public Housing Authority Housing Choice Vouchers, provide a critical component for many continuum of care's resources for homelessness. VASH units provide permanent supportive housing for disabled veterans, many of whom have experienced long-term homelessness. While VA Medical Center staff are prohibited from entering client-level data about veterans into a COC's HMIS, the Public Housing Authority staff and community-based partners do not have these same restrictions. Many communities have brokered creative agreements to enable the PHA staff and other community-based partners to enter VASH client-level data. VA and HUD supports these local solutions as well as encourages communities to continue to explore ways of capturing data on residents within the VASH program to be entered into the HMIS systems. One of these unique partnerships is highlighted in Dayton, Ohio, where the VA staff have negotiated read-only access to their community HMIS. This enables VA staff to identify homeless veterans and link those veterans to available resources such as the VASH vouchers. Even if your VASH program does not participate in HMIS, all VASH units should be included in the COC's HIC If a project uses VASH as a subsidy source for projects that are already listed on the HIC, make sure not to double count those beds or units. COC should look closely at where VASH is being used and whether VASH vouchers are already accounted for in one or many of these projects. SSVF, or Supportive Service for Veteran Families, is a new VA program that provides homelessness prevention and rapid rehousing services. Grants will be awarded to private nonprofit organizations and consumer cooperatives to assist very low-income veterans and their family with supportive services to prevent and end homelessness. SSVF programs will be required by the VA to participate in their local HMIS systems. Grant contracts will be executed in late June or early July. Programs should be up and running by July. After selected, SSVF grantees should begin working with their HMIS administrators to set up the SSVF program in the HMIS system as soon as their grants are executed. Licensing and other costs associated with HMIS participation will need to be covered within the SSVF admin budget. SSVF services are similar to HUD's HPRP program. Data collections will include only the data elements included in HUD's March 2010 HMIS data standards. Data collections should include all of the data elements that HPRP programs collect currently. Data collection and HMIS participation requirements for the VA SSVF program are exactly the same as HUD's Homeless Prevention and Rapid Rehousing Program, or HPRP. The VA SSVF grantee will eventually export client-level data from their HMIS systems and transmit that data to the VA. That data will be exported and transmitted in either an CSV or XML format. Eventually, we want to be able to have monthly uploads of the SSVF data, but during the initial months of the implementation, the VA wants to ensure that the systems and protocols are in place to accept complete, accurate, and valid extracts. Uploads will occur quarterly for the first 2 quarters of SSVF activity. And with that, I'd like to turn over the presentation to my colleague, Matt White, who will discuss VA-funded beds within the HIC.
Thanks, Stephanie. As many of you know, HUD released a listserv announcement last week about VA participation in the housing inventory chart. So we want to reiterate that the HIC, the housing inventory count, should include all VA-funded residential programs that provide housing for homeless and formerly homeless persons. HUD will be issuing additional guidance soon describing the process that CFCs should use to reconcile the HIC data that they submitted directly to the HMIS and the VA-funded bed data that may be added later by HUD. But in the meantime, please submit your HIC data according to the HIC guidance that is posted at the HRE website, and that's listed at the bottom of the slide here. According to that guidance, CFCs should include VA-funded beds that are dedicated for homeless persons in the housing inventory count. So any bed that's designated for someone who is homeless should be included in the HIC regardless of who funds it. Just so happens if it's a VA-funded bed, it should absolutely be included if it is serving a designated homeless population. instructions on which VA programs should be included and how each program should be identified are described on this slide. Emergency shelter or VA contract beds should be listed in the housing inventory account, and they should be listed obviously under the emergency shelter heading. The VA grant and per diem program should be included in the transitional housing category of the HIC with the prefix GPD. HUD-VASH vouchers should also be included in the housing inventory account as permanent supportive housing, and they should use the prefix VASH for those programs. For purposes of calculating HMIS participation and the bed coverage rate calculations, HUD has indicated that they will not include HUD-VASH units as part of each community's HMIS participation calculation. HUD doesn't want to penalize CFCs with low HMIS bed coverage rates for the HUD-VASH beds when, in fact, we know that those programs that are often administered by VA medical centers, the VA medical center staff are prohibited from entering VASH data in HMIS. So although we definitely want the VASH units included on the housing inventory account, HUD and VA recognize that some of those units will not actually be entered into the HMIS. The VA and HUD will be meeting regularly over the next couple of weeks to develop further guidance regarding how to set up SSVF programs in HMIS using the program descriptor data elements, and the VA will provide more explicit direction for listing SSVF programs on the HIC, on the EHIC. Obviously, you do not have to enter the SSVF programs on the current HIC. They'll be listed on next year's HIC, or the 2012 HIC. Moving on to roles and responsibilities. Starting with HMIS project staff. The slide here identifies a number of the core activities that are expected of HMIS project staff as new users come online or new programs come online. Essentially, these include conducting startup trainings with VA grantees, could be GPD grantees, could be community contract providers, or in the next couple of months we'll expect that the SSVF program, those grantees will also be having startup meetings. Any new user will execute a agency participation agreement with the HMIS staff, and the HMIS staff can negotiate that or coordinate that. The HMIS project staff will also work with end users to execute end user agreements. If there are any locally required contracts for HMIS participation, the HMIS project staff will also manage that process. If there are any required user fees or license requirements, the HMIS project staff can negotiate that. And finally, the HMIS project staff will complete the agency and program setup. Using the program descriptor data elements, they essentially describe the program, the number of beds, where it's located, and all of that is entered into the HMIS just a single time and then updated annually thereafter. But that is the responsibility of the HMIS project staff. Eventually, not in the near future, but eventually the project staff will also be responsible to work with the SSVF grantees to upload client-level data to the VA's server from the HMIS system. Let's talk about roles and responsibilities for the VA grantees. The HMIS staff are not the only ones that have a responsibility. VA grantees also will be participating in HMIS, and the list here identifies some expectations for the VA grantees. Obviously, VA grantees will also participate in some of those startup meetings and conversations to orient them to HMIS expectations and any local rules or governing restrictions. The local grantee will also execute agency participation agreements, end user agreements, any locally specific required contracts. There may not be one, but if there are one, the grantee is responsible for entering into that contract agreement. They'll finalize any required user fees or licensing requests. Again, not every community has licensing fees or end user fees. Some communities do. And then finally, they'll complete the agency program setup procedures. So they'll work with their HMIS project staff to describe the number of units provided by the grant, all of the funding sources, where the beds are located, the type of program, And again, they'll work with their HMIS project staff to make sure that that information is correctly entered into the HMIS, and then revisit it annually to make sure that it's updated and continues to be correct. Finally, if there are any local HMIS user groups, the VA grantees will participate in those user groups, which provide a great opportunity to learn from other users in the community about tricks and tips for using the HMIS, getting updates or information about new policy directives, and generally being connected to the community of users who are participating in the system. The VA recently launched a new database, the Homeless Operations Management and Evaluation System, or HOMES. If the VA grantees who are participating on the call, this will be familiar to them. It will not be as familiar to the HMIS project staff or the continuum of care staff. HOMES is essentially designed to facilitate and integrate the collection of standardized client-level case management and detailed health services information from the VA-funded programs that serve homeless veterans. The goal of HOMES is to enable the centralized management of data from all homeless veterans served in VA-funded programs and to make those data accessible for analysis and reporting. So HOMES functions essentially as a VA data collection and management initiative. With the HOMES system, the VA intends to track individual veterans across all VA-funded programs and facilitate better understanding of client needs and assess program performance. The important thing to remember about HOMES is that it is internal to the VA. HOMES will not be accessible to community-based homeless assistance providers. HOMES is essentially an HMIS system that is internal to the VA. We bring it up here because many of the grantees that are participating in HMIS may also share a responsibility with HOMES participation. So the acronym is important to understand or to know, but for any of the continuum of care or HMIS project staff, they will have very little, if any, interaction with the HOMES system. As I said, in many ways, HOMES functions as a data management system, much like HMIS, except that HOMES is only accessible to VA staff. The registry. The VA has established a registry of all homeless veteran data. This is different from the HOMES system, which functions as kind of a case management and an HMIS. The registry, on the other hand, is a much more comprehensive data warehouse within the VA that integrates or collects data from the HOMES system, but also is much more comprehensive and collects data from other services and programs that veterans might touch on that aren't necessarily designated for veterans. For various legal, privacy, and security reasons related to the broad range of sensitive clinical data collected by programs that are operated directly by the VA medical centers, the VA determined that it's not appropriate to require internal VA programs to enter data directly into HMIS. So that's why there is this prohibition around VASH being entered into, around VA staff entering VASH data into HMIS. However, part of the larger VA HMIS strategy, as Vince talked about and Roger reiterated at the beginning of this call, is to identify ways to merge veteran data from the VA's internal HOMES system, the internal system, and HMIS, which is the community-based system. This data integration will happen in stages. Initially, client data from the SSVF programs will be regularly submitted to the VA for program reporting and analysis purposes, and this is what Stephanie described earlier. Since the GPD programs, the community-based contract beds and HUD-VASH data, will be duly entered into both systems, both HOMES and HMIS, there's no need to transfer that data into the registry because it will already exist or will already come through the HOMES system. Since GPD, community contract beds and VASH programs will be entering universal data in each locality's HMIS about the homeless veterans served in that area, the locality will be able to immediately generate more comprehensive reports and build a better, more complete understanding of veteran homelessness at the local level. Let's talk about the VA's long-term plan for data collection and management. Comprehensive data on homeless veterans served in VA-funded and operated programs such as the Veteran Justice Outreach, the Healthcare for Homeless Veterans, for example, it's valuable information that could benefit local communities as these communities try to build a more complete, more comprehensive, a more accurate picture of the extent and scope of homelessness that exists in their community, in their CFC. So for these reasons, the VA would like to make these data available to continuums of care. The VA is currently working with HUD to develop data integration strategies that allow for the export of homeless veteran data from the registry and the migration of those data to the appropriate CFC where the services were provided or where the program is located. This flow of data out of the registry, out of the VA's internal registry, the data warehouse, and out and distributed into the various or the appropriate CFCs and HMISs across the country is several years away from implementation. We bring it up here because we want you to understand the long-term vision for data collection and data management. So it's a complicated picture where data is being collected at the local level in the HMIS, it's being collected within the VA through the home system, and the data warehouse or the VA registry serves as the sort of centralized, consolidated data warehouse for all veteran data. But many of the data in that system would benefit local communities, and that's why the VA with HUD has articulated a long-term strategy to make some of that data, not all of it, but some of it on an appropriate basis available back to the communities. So each community, even though you might not have served that veteran, that homeless veteran, in a program funded by HUD funding, you would have access to the data about that homeless veteran who was served in your community. Again, we're probably 3, maybe even 5 years away from this bi-directional data flow, the ability to export data from the data warehouse, from the data registry, the VA registry, and import that into each individual CFC. The website that Stephanie highlighted earlier and mentioned in her remarks lists a number of resources that are going to be incredibly useful to not only to HMIS project staff and the continuum of care leadership, but certainly to the GPD grantees and soon to be SSVF grantees as they begin implementing those programs. These useful tools you can access at the website listed that Stephanie provided, and I'll provide one of the last slides of the training lists that website once again. But if you want to get additional information about HMIS or you want to review resources and tools that are available for you that describe HMIS implementation and its use, this slide essentially identifies or lists those resources. We've developed an HMIS program-specific data collection training guide. It goes for each program, describes what are the expectations for data collection. We've developed a program-specific intake template that walks you through from a GPD, VASH, and SSVF perspective, the intake process for data, and then also the corresponding exit template. So you would be able to download these templates and use them as your data collection guide or your data collection resource when you're interacting with your veterans, collecting initial data and then exiting them. We have these intake and these exit templates, and we also have this general resource guide available for you for download at the VA's HMIS resource on the homeless site. I encourage you to download these tools and use them. The VA is moving rapidly to clarify HMIS participation expectations and provide support materials and resources for you. And in the next month, the VA was going to be announcing SSVF grantees. The VA will be releasing explicit guidance about HMIS participation expectations as it relates to the SSVF program and those grantees. And we'll make every effort in the next couple of weeks as those training materials are released to also include continuum of care staff and leadership, HMIS project staff, and make sure that that all people who are going to be interacting with these programs, not just the actual VA grantees, but also continuum of care and HMIS staff, have access to these future trainings and updates. Currently, the best resource to check for regular updates and information is the VA's homeless webpage. The address is provided here at the bottom of the slide. I encourage you to check out that website. It not only lists the resources that we listed on the previous slide, but you'll also find other helpful information such as frequently asked questions training materials, guidebooks, etc. We're in the process right now of finalizing a HMIS training manual. That manual will also be posted to the VA's website, and it provides a step-by-step instructions and directions about participating in HMIS. We'll be planning over the course of the next couple of months, as SSVF grantees are announced, additional webinars and trainings. Certainly there'll be more in June, and we also recognize that, as I said before, that the VA grantees are not the only audience that share an interest in this. We'll be also developing specific materials and providing outreach to vendors, HMIS vendors and HMIS project administrators. We want to make sure that they can have access to these data collection and reporting resources as well. In July, the VA will host additional trainings and likely site meetings for SSVF grantees to go through not only the program requirements for operating SSVF programs, but there'll be explicit direction on the data collection requirements. We've only just highlighted the expectations around data collection in this training for SSVF grantees. In future trainings, we'll go through in a much more detailed and deliberate way the specific data elements or questions that need to be asked of every SSVF beneficiary, the available response categories, and additional guidance around expectations of nuances of how to understand data and how to apply program rules in the data collection setting. In addition to that, we'll be making technical assistance resources available to communities, either through downloadable trainings and resource manuals and guides that we're developing that will be posted to the website. But as Stephanie mentioned earlier, there's an important resource that's available to you, and that is the VA HMIS at aptosoc.com website. If you have questions that occur to you after this training or as you're reviewing these materials with staff in your programs or other staff in your community, it may occur to you that you have questions, and unfortunately, because of the number of participants for this training, we weren't able to take questions on this call. But if you have questions that you identify at a later time, there are technical assistance resources available for us to respond to those questions, not just in email, but by also providing maybe some phone consultation, and we'll provide more information about how to access those resources in the future. So as you have questions, as I said, as you're reviewing these training materials, and we'll make them available, all the training slides that we've presented today will be posted to the HRE. They'll be posted to the VA's website. You can download those at your convenience and review the slides with your staff and with other community members. If you have questions as a result of those discussions and you want to follow up and get responses to those questions or clarify anything that we've mentioned today, use the two resources that are listed here on the site. The HRE has a help desk function. If you go to other homeless programs, you can select the VA as a drop-down menu, the VA or other homeless programs outside of HUD-funded programs, and just type in a question right there. Those questions get filtered to APT Associates as the VA's technical assistance provider for HMIS issues, and we'll make sure to respond to that question. You might also want to review the frequently asked questions. There are a number of questions that have come in, and we've responded enough over time that we post the answer, the original question and the answers to those questions as a documentation of policy guidance that's been provided over time. Those frequently asked questions are also available on the website. And as I said before, the VA HMIS at aptosoc.com provides another resource for you to answer or to document or list questions that you have, ask questions, and get responses back. We hope that this training has been helpful. Again, just look for more information about additional trainings specific to the SSVF program later in July, and reference those websites that I mentioned earlier to download these training slides and additional training materials to review them in a kind of a self-directed way. We appreciate your time this afternoon and look forward to answering your questions. And we'll be posting information about additional trainings in the very near future. So I hope everyone has a wonderful day, and thank you so much for your participation.
So Matt, this is Vince. I wanted to just, before we signed off, thank you and Stephanie and Roger for really a terrific overview. And as you note, we're eager to accept questions and really want to roll up our sleeves with our community partners to help with this implementation. So like you, appreciate everybody's time and attention, your interest, and all your support, and we look forward to working with you on this as we go forward. Thanks.
Great. Thanks, Vince. Thanks, everyone. Good afternoon.
Thank you. Bye-bye.